Dr. Fathima. Dr. Fathima will be speaking on long-term outcome of modified capsular tension ring fixation and IOL placement in ectopia lentis cases.
Very good morning to all. This is about long-term outcome of modified capsular tension ring fixation and IOL placement in ectopia lentis cases. As we know, ectopia lentis poses unique surgical challenges. Many a times, surgeons prefer to remove it and go for scleral fixation or iris fixation IOL. But the advantages of bag conservation using CONE ring is the lower rate of vitreous prolapse, and thereby the risk of retinal detachment is lower in these cases. Literature supports this. So the aim of the study is to analyze the long-term outcome of this bag conserving procedure in ectopia lentis patient. Ours is a prospective interventional case series where the less than 16 years of age children were included, and those children who had prior intraocular surgery, ocular trauma and comorbidities were excluded. And the data was analyzed on the basis of IOL centration, best corrected visual acuity and complication. This is the surgical procedure where clear corneal entry is made and rhexis is being done using micro forceps. And the Hoffman pocket is made from the corneal side, and the edges of the pocket is marked, and using a double arm 9O proline suture and introducing a 26 gauge cannula from the through the pocket. One arm of the needle is taken out and the other arm is passed through the eyelet of the CONE ring, and again then the second arm is passed. Before that, the wound is extended a bit more to allow a comfortable introduction of CONE eyelet, and the CONE ring is placed in the bag, and suture knots are retrieved from the pocket, and suture ends tied together and knot is buried into the pocket, and IOL is placed in the bag. So it was 35 eyes of 21 patients, and our mean age is 8.7 years, ranging from 4 to 16 years. Majority were male patients and left eye, and it was most of the cases were bilateral. Our mean IOL power was 21 diopter IOL, and the CONE type was either 10L, 10R or 11R. And the suture, it was mostly 9O proline suture. And temporal subluxation was the most common subluxation we observed. And mean axial length was 23.5 mm, and average follow-up is 2 years, and ranging from 8 to 53 months, it's nearly 4 to 5 years. IOL centration is observed in most of the cases. And best corrected, if we look at the uncorrected visual acuity and best corrected visual acuity, there is a little bit difference. This is due to purposeful undercorrection considering myopic shift in younger children. And when we look at the Snellen's acuity, 94% showed visual acuity more than 6/12. Remaining 6%, this is due to amblyopia developed due to late presentation and late intervention. And there was 2 eyes, those showed minimal decentration, but not yet required surgical intervention. There was no vision-threatening complication. And posterior capsular opacification was observed in 13 eyes, 37.1%. When the mean duration was 2 years post-surgery. When we look at the other studies using CONE ring, there were studies that included both adult and pediatric patients. So when we consider the studies with only pediatric patients, here is an interesting study by Chen et al. Where they have done 174 eyes, all are orphan children. And the interesting observation is there were only 2 eyes showed retinal detachment out of 174 eyes. They claim that is due to minimal disruption of vitreous basement by following the bag conserving procedure. So when we compare our study with other similar age group studies, the minimal decentration, the number is similar, and this PCO incidence. Here, if we look at the Lia K et al., the interesting observation is they have done prophylactic eye capsulotomy in post-surgery. That denotes the safety of applying eye capsulotomy in these cases. This is a study where 37 eyes of 22 children was done by Tina et al. Here the difference is the age group was very less, 52 months mean age. So they end up with a high number of, out of 37 eyes, 26 eyes had undergone secondary surgery for visual axis opacification. But our age group is little elder, so none of our cases required surgical intervention. And the mean duration of 2 years post-surgery to develop visual axis opacification allowed our youngest child 4 years to become 6 years and cooperate for capsulotomy procedure. So the long-term outcome of COA ring fixation shows good outcome in visual acuity and low complication rate.
Two things I would like to
Thank you.
ask. Were there any cataractous lenses in your cases?
No,
They
no.
were all clear lenses.
Yeah, all
so
are clear.
anyway, the chances of posterior capsular obfuscation reduces markedly in that case. So that is one reason. Secondly, you said your age group was elder. So it was above 6 years.
Minimum age is 4 years.
In your study.
Yeah.
Okay, so how many children were there above, like less than 8 years?
Very less, only it ranges up to 4 to 16 years.
No, but how many were there less than 8 years? Because you don't need to undercorrect them, as you said, no, because your uncorrected visual acuity was less in a lot of them.
Yeah. Only,
I mean, because of the cylindrical power which is induced as such because of the incisions itself, the surgically induced astigmatism, rather than actually the undercorrection which was required. Because normally you don't need to undercorrect after the age of 6 years.
yes. We undercorrect a bit 0.5 diopter up to 10 years of age.
How many were Marfan's out of these? Because you didn't talk about etiology of
Yes, sir. Actually, genetically proven Marfan we have not come. Till now, we are practicing for Marfans. We don't do such intervention. But clear cut that patients that fit in that Gens criteria, we have not seen Marfan. It's more all are isolated ectopia lentis, and some are familial isolated ectopia lentis.
But sporadic ectopia is not very common actually. So there must be
Yes, sir. We are analyzing the data. We want to.
or other conditions.
Yes, sir. We are doing.
Yeah, particularly those conditions I think should be ruled out because
Yeah.
it's important. There are systemic issues which can be
Yes, sir.
having long-term issues.
We are doing echocardiogram for every patient, and we are looking for that aortic root Z scoring to fit in the criteria of Marfan. But sometimes patients present with that Marfanoid habitus features, but they are not exactly fitting into that aortic root criteria, echocardiogram criteria, and genetic criteria.
You have taken into account ectopia lentis due to trauma also?
No, in this series it didn't.
You did
There was no trauma.
And
case.
how long was your follow-up? How long?
Maximum is 53 months, 4.5 years.
Thank you.